Are you the patient safety officer? I want to complain about this EMS incident.
Yes, it's a pretty shocking incident, isn't it?
I was totally shocked. Someone's made it SAC 1. SAC 1 is supposed to be for serious incidents.
Well, this incident looks pretty serious.
How can you say that? The operation was a great success. Everything went perfectly. How can you call this SAC 1?
Okay. For starters, the patient died.
But the operation was perfect. Patients die all the time, you can't blame me for that.
No one's blaming you, but we need to figure out if we could have treated the patient better.
No, that's not possible. The operation went perfectly. He got the best treatment.
And yet still the patient is, how can I put this? Not numbered among the living.
Your point is?
He was a 47-year-old man who came in for routine elective surgery. He might have been expecting, how shall we say, a less terminal outcome?
Don't be a smart-arsed little snot. He died from a rare, but well-described complication, which was explained to him beforehand. He gave informed consent knowing the risks. He got the best evidence-based treatment.
So, overwhelming post-operative sepsis is the best evidence-based treatment.
Some patients get infections, but once it was diagnosed, we treated it with the best antibiotics.
To which he was allergic, causing anaphylactic shock.
Typical. This is a classic case of hindsight bias. How was I to know he was allergic?
It was written in his medical record.
Well, in that case the nurse should have picked it up. Anyway, he didn't die from that. My team resuscitated him. We saved his life.
Right up until he went into acute renal failure.
So we dialyzed him.
As well as adult respiratory distress syndrome.
He got intubated and ventilated. He had access to world-class intensive care. The family couldn't ask for anything more.
Well, technically, not quite correct. We actually spoke to his wife, and she did have one teeny-weeny additional request. A living husband.
Look, he died of a massive stroke. I'm a surgeon, what has a stroke got to do with me? It could have happened to anyone.
You don't think it could have been related to his warfarin therapy?
Which he needed for his pulmonary embolism.
With an INR of 5.5?
I'm sorry, do I look like a hematologist? I'm a surgeon. I cut things and stitched them up. The cutting and the stitching was perfect. I can't understand why the wife is so upset.
Because her husband is dead. He's bereft of life, he rests in peace, he's pushing up the daisies, rung down the curtain, and joined the choir invisible. He's an ex-patient.
But the operation was perfect. You can't call this SAC 1.
What part of SAC 1 don't you understand? He got a post-op infection, developed sepsis which was untreated for 24 hours, given drugs in the presence of a known allergy, sending him into multi-organ failure. His extended length of stay led to a DVT and pulmonary embolism which was so appallingly treated that he developed a fatal intracerebral bleed. If he was a poker player, that's the royal flush of hospital complications. The only thing that didn't go wrong is that you operated on the right patient, and I don't think his wife will thank you for that. Exactly which part of this incident is not a frigging SAC 1?
I'm a surgeon, the operation was perfect.